Iron Warriors. Welcome to part 2 of chapter 14. In the first part, we analyzed how overtraining is not just a physical obstacle but one of the primary ways progress is destroyed. More work does not equal better results. Now we're going to set aside the mythology of infinite effort and address, with the precision and rigor Mentzer demanded, what truly accelerates lasting adaptations without paying the price of broken recoveries. In this second part, we'll break down practical tactics and concrete measures, how to optimize nutrition and sleep to aid recovery, why you should prioritize anchor exercises that produce the strongest adaptive signal, how to adjust cadence and time under tension to maximize stimulus without wasting volume, and when and how to safely introduce advanced techniques to force real adaptations without falling into overtraining. Everything we explain will be geared toward measurable results and preserving recovery capacity, smart intensity, not irrational accumulation. We will also examine the psychological errors that sabotage patience, short-term bias, comparison with others, and the volume illusion that pushes us to abandon plans that are working. I'll give you practical, proven mental strategies to maintain a rational and a valuable focus, because smart consistency beats muscle anxiety. We will also bring 3 real-world applicable N=1 case studies for beginner, intermediate, and advanced trainees with a checklist and a specific action plan for each case. What to measure, what to change, and when. And as an operational closing, an 8-week roadmap ready to be pasted into your notebook. Steps, metrics, and clear decisions to validate whether your progress is real or if it's time to reprogram. We'll finish with a reflection in line with Mentzer's thinking. Measured patience defeats the noise. If we truly seek smart and permanent progress, we must not punish the body or the mind for expecting quick results. Share this video. It helps more people stop confusing work with progress and start training with purpose. Section 6: Tactics to accelerate real progress without cheating. Quick summary. What you'll take away. This section explains how to optimize the factors that truly drive adaptation: nutrition, sleep, prioritizing anchor exercises, cadence over TUT, time under tension, and when and how to safely introduce advanced techniques to force real adaptations without entering overtraining. Everything that follows is practical with numbers, examples, and protocols applicable from Monday. 1. Nutrition, the foundation for converting stimulus into growth. Principle: without sufficient fuel and amino acids, failure equals useless damage. Nutritional optimization accelerates the conversion of stimulus into mass and strength. Calories macro control, gaining mass natural. Heavy duty plus 200 to plus 400 kilocalories per day above maintenance. Do not make large super surpluses. Excess generates fat and more work for the system. Maintaining eat at maintenance. If you are in a deficit and stall gives, prioritize returning to maintenance before trying to increase volume. Protein, recommended range natural and intense training. 0.8 to 1.6 grams per kilogram day. Example, 70 kilograms person gives 112 to 154 grams per day. Distribute over 3 to 4 meals, for example, 25 to 40 g protein per meal. Carbohydrates for performance, 3 to 6 grams per kilogram day, depending on load and body size. Higher if long voluminous sessions or intense anaerobic work. In heavy-duty practice, short but intense sessions. Aim for 3 to 5 grams per kilogram. Prioritize peri-workout carbs. Fats, 20 to 35% of total calories sufficient for hormonal function. Practical timing: peri-workout. Pre-workout 1 to 2h before meal with protein plus 20 to 50 g carbohydrates according to tolerance. Post-workout 3090 min 20 to 40 g protein plus 30 to 60 g carbohydrates to replenish glycogen and promote synthesis. Hydration and micronutrients, sufficient water. Monitor vitamin D, iron, ferritin, especially in persistent fatigue, and correct deficiencies with a professional. Useful and safe supplements optional. Creatine monohydrate 3 to 5 grams per day improves strength and recovery. Caffeine pre-workout, as an energy enhancer. Use with caution if it affects sleep. Vitamin D if deficient, nothing miraculous. The priority is Kycol protein sleep. To sleep in recovery, the silent multiplier principle. Most anabolic and neural recovery occurs during deep sleep. Goals 7 to 9 hours per night. Quality is greater than or equal to 7/10. Practical hygiene, fixed bedtime. Turn off screens 30 to 60 minutes before dark. Cool room. Avoid stimulants late. If there are chronic problems, prioritize intervention. Evaluate caffeine, stress habits. Do not try to compensate with more training. If you are going to use advanced techniques, plan for an extra 1 to 3 nights of optimal sleep in the week of application. 3. Prioritizing anchor exercises. How to choose and order them. Principle in heavy duty. The goal is 1 effective set per exercise. Choose the movements that will transfer the most to strength and size. What anchors are: compound movements that allow high load and recruit the most mass: press, squat, leg press, deadlift, hip hinge, rows, pull down. Order rule: progressive warm-up 2 to 3 non-fatiguing approximations. Effective set on the anchor exercise. This is the main work. Optional: 0 to 1 brief accessory work, not to failure for balance. Prefer machines when seeking safety, machine press, leg press. If working to failure and/or using advanced techniques, machines reduce mechanical risk and facilitate control. For cadence and TUT, how to structure each set for maximum benefit principle. Cadence controls TUT, influences intensity and affects the quality of the stimulus. Recommended cadence is practical and consistent. Eccentric. 3 to 4s pause stretched position. Bottom. 0 to 1s concentric. 1 to 2s target TUT per set. 40-80s in most movements for hypertrophy intense stimulus. Example with a 3s ECC. 1s conch cadence gives 4s rep gives 10 reps approximately equals 40s TUT. How to use it. Plan rep ranges that, with your cadence, fall within the target TUT range. If you want 50s TUT and your rep lasts 4s gives aim for approximately 12 to 13 reps. Do not change cadence mid-block if you are measuring progress. Maintain cadence so TUT is comparable session to session. 5 micro-progressions and periodization without breaking recovery principle. Small, measured, and systematic increments, not large jumps. Applicable rule. Add 1 repetition when possible. When not, add 1 to 2.5% load. Do not combine both in the same week. Practical periodization microcycles base block 6-8 weeks, 1 effective set per exercise, sessions every 4 to 10 days per group based on recovery. Record reps RPE TUT. Deload for 1 week at the end of the block light activity, no sets to failure. Repeat the cycle, adjusting micro increments if 2/3 anchors show progress. Micro progression, example 70 kg person. Week 1, 80 kg times 8 reps. Week 2, 80 kg times 9 reps, gives micro progression. In week 3, try 82.5 kg times 8 reps. If it fails, return to the previous weight and consolidate reps in the next window. 6. When to introduce advanced techniques, and how to do it safely. Principal intensifiers are tools for controlled plateaus. Using them with criteria avoids overtraining. Prerequisites all must be met. Have consistent records for is greater than or equal to 8 to 12 weeks. Have demonstrated stagnation in is greater than or equal to 2 anchors and have general recovery within parameters. RHR plus or minus 2 BPM. Sleep is greater than or equal to 7H. Be capable of executing perfect technique. Prefer machines, spotter. Be willing to add extra recovery days afterward. Usage rules non-negotiable. Only 1 advanced technique per cycle. 1 cycle equals 6 to 8 weeks. Only in 1 exercise per session and prefer machines or exercises with a spotter. Maximum frequency. 1 to 2 uses per muscle every 4 to 8 weeks, no more. Extra recovery, add plus 3 to 7 days before repeating intense work for that muscle. Record DOMs, RHR and RPE for the following 7 days. If they worsen without improvement, in 2 to 3 sessions gives do not repeat and extend recovery. Practical techniques and safe protocols. Rest pause safe protocols. Do a set to technical failure or 1 rear if you prefer less stress. 10-15s rest, 2 to 3 more repetitions. Repeat 1 to 2 times. Use only on machines or with a spotter. Record effect and add plus 3 to 5 days of recovery. Pre-exhaustion. 1 isolation set not to failure RPE 8. For the target muscle, for example, pec fly. Immediately 1 effective set on the compound press to failure. Do not do this combo more than 1 time per muscle per cycle. Avoid if you already have fatigue signals. Controlled negatives only with a spotter or in a rack. Focus on 4 to 6s eccentric, 3 to 6 repetitions. Assisted concentric, high eccentric damage gives strong DOBs. Maximum caution, low frequency. Every 6 to 8 weeks, maximum. Drop sets or forced reps, much more aggressive. Reserve only for very experienced lifters and rarely. 7. Practical monitoring to avoid overdoing it. Warning signs. Morning RHR, if it rises plus 3 to 4 BPM for several days gives caution. Plus 5 BPM sustained gives break. RPE, if it increases by plus 2 with the same load without improvement gives reduce intensity. DOMs, if DOMs limits technique 72H gives extend recovery. Sleep. Appetite and libido sustained drops gives review nutrition, sleep and consider a pause. If after an advanced technique RHR and DOMS worsen without progress gives desist and extend deload. 8 practical examples week by week application. Case A, natural 70 kilograms, advanced heavy duty frequency, 1 session per group every 7 to 10 days. Nutrition. Plus 250 kcal protein, 1.8 grams per kilogram, 126 grams day. Effective set. Machine press, 82.5 kilograms times 8 reps. Cadence 3/1. 1 gives TUT approximately equals 32s. Micro progression, if plus 1 rep appears in 2 cycles gives increased load by 2.5%. Advanced technique. If no progress in 2 anchors in 8 weeks in RHR OK, introduce rest pause on the leg press once in that cycle and monitor for 10 days. Case B intermediate who wants to accelerate without PEDs. Prioritize improving sleep and plus 300 kcal first. Maintain 1 effective set per anchor. If after 8 to 12 weeks no progress, change 1 anchor for a machine that improves biomechanical position or introduce occasional pre-exhaustion for the chest. Machine fly 1 sub max set plus machine press 1 effective set. 9. Checklist to apply tactics today. Do I have 8 to 12 weeks of records? Yes, no, RRHR and sleep, okay. Yes, no. Did you try small micro progressions before using intensifiers? Yes, no. Will you use only one technique per cycle and in one exercise? Yes, no. Do you have a spotter safe machine for that technique? Yes, no. If you answered yes to all, gives proceed with a specific technique in strict recording. If no, gives correct the base sleep K-call technique first. 10. Final message. Apply with your head, not your ego. All the tactics above work because they respect biology. Stimulus gives recovery, gives progression. Any attempt to accelerate without fixing the substrate calories, sleep, stress is a waste of time. Use micromeasures, control with your notebook, and let the data, not the feeling, tell you if the intervention was worth it. Section 7. Psychological errors that sabotage patients and how to break them. Extensive, practical, and oriented towards heavy duty. Definitions, real examples, and actionable mental strategies to sustain a rational and measurable approach. Introduction. Why this matters. Most failures in sensible programs are not due to technical programming but to the practitioner's psychology, impatience, comparisons, and mental habits that push them to change plans just when it was starting to work. In heavy duty, where intensity is high and gains are often slow or micro, the mind tends to confuse effort with result. This section teaches you to recognize these biases and gives you practical tools to control them. Guiding phrase in the Mentzer spirit. Train with reason, not with pride. Use it as a mantra when you feel the urge to change plans. 1. Main psychological errors, what they are and how they translate into gym attitudes. A short-term bias, temporal myopia. What it is, preferring immediate results over sustainable gains. How it manifests, changing plans every 2 to 4 weeks because no changes are seen. Heavy duty example. Abandons an 8 to 12 week block because no difference is seen in the mirror after 3 weeks despite improvements in reps. Why it harms. Prevents completing the minimum window needed for adaptations to become visible. B. Social comparison, external benchmark. What it is, judging one's own progress by comparing oneself to others, social media people, gym mates, pros. How it manifests. Adopting routines copied from others that seem to work for them. Heavy-duty example switches to a very high-volume program because an influencer looks huge, without checking if they are using PAs or if their recovery is different. Why it harms. Leads to protocols incompatible with your biology and availability. Work, sleep, family. See volume illusion. More equals better. What it is, believing that more sets days always generate more progress. How it manifests. Adding sets just in case every week. Heavy-duty example. Goes from 1 to 6 sets per muscle to force adaptation, and ends up stagnant. Why it harms. Destroys intensity and generates chronic fatigue. D-action bias, need to do something. What it is, the intuition that inaction is bad. Preference for acting even if the action is counterproductive. How it manifests when something fails, immediately increasing volume frequency instead of measuring. Why it harms. Action without data usually worsens the situation. Sunk cost and ego. What it is, persevering out of pride after investing time, effort, or changing out of shame. How it manifests, continuing to train hard even when the data calls for a stop, or changing plans to not admit the previous one might have been wrong. Why it harms, clouds rational decision making. Confirmation bias and the search for shortcuts. What it is, seeking evidence that confirms what one wants to believe. For example, I feel harder this week equals better, even though objective metrics don't improve. How it manifests, interpreting any small sign as I'm on the right track and not confronting the logbook. Why it harms, paralyzes objective correction. To practical mental strategies, tools to sustain patience and rationality. Key piece. Turn impulse into process, don't act on feeling. Apply a decision filter that turns emotional reaction into a measurable procedure. The check for rule, pre-decisional filter. Before changing a plan, pass for mandatory checks. If all are positive, then consider the modification. If any fail, do not change. Window fulfilled was the minimum window completed according to level. Beginner for WKS, intermediate 6 to 8, advanced 8 to 12. Data in 2 anchors. Did 2 out of 3 anchors improve? Reps or load recovery, RIH, RHRV, and sleep stable. Life context, was there no external stress, travel, job change, illness? That explains the drop. If then, if all 4 are yes, gives evaluate a deliberate change. If not, any gives do not change. Apply the appropriate intervention. Rest, nutritional adjustment, technique. B. Decision journal, 48-hour script. When you feel the urge to change, note the impulse. What motivates you to change? Wait 48 hours. Review the logbook and apply check for. Decide with data. This simple cooldown reduces impulsive decisions. See process goals versus outcome goals. Process-oriented approach. Outcome goal, I want to look big in 8 weeks, gives bad for patience. Process goal, record 100% of sessions. Increase 1 rep in 8 weeks on press, gives controllable and calming. Reformulate weekly goals into measurable processes. D. Cognitive anchor, evidence routine. Each week spend 10 to 15 minutes reviewing your notebook with these questions. What improved objectively? What worsened? What change, if any? Will I make next week only one variable? Repeating this will habituate you to slow, evidence-based decisions. Public commitments/accountability. Announce your 8 to 12 week block to a partner, coach, or community. Constructive social pressure reduces premature switching. Even better, share data, not feelings. Every 4 weeks, pre-mortem, and if happens, plan before starting a block. Write down failure scenarios and the clear response. If no +1 rep in 8 weeks, gives review sleep and adjust Keiko +200. If RHR +5 BPM, gives stop having a plan in advance, reduces panic, ego when things don't go well. Cognitive reframing. Phrases and mantras, short phrases that recalibrate the mind. Micro progress today equals macro gain tomorrow. Patience is the tactic, impulsivity is the enemy. The notebook commands, the ego waits. Repeat them in the gym when doubt arises. Practical technique for impulse urge surfing. When you feel like changing or adding sets, practice 3 minutes of slow breathing, 4 to 6 breaths. Observe the urge. Without acting, let it subside. Impulse control studies apply here. You don't need to defeat the urge, just let it pass. 3 concrete tools to defend your plan, routines, and scripts. A checklist before changing. Paste in notebook, minimum window fulfilled for my level. 2 out of 3 anchors with objective improvement. Hats are dua BPM HRV okay or within tolerance. Sleep 7+H average. No exceptional external stress. If all okay gives, I can consider one controlled change. If not gives, I do not change. Verbal script for the gym when pressured or compared. Partner, look what so-and-so does. Try this. Use short response. Thanks, I'll check it out later. For now I'm following my cycle and my data. Practicing responses avoids getting into debates and maintains the plan. Controlled experiment plan if you decide to try something new. Clear hypothesis. If I introduce rest pause on the leg press once, I expect +1 rep in 8 weeks on that anchor duration, 6 to 8 weeks. Single variable. Only rest pause. Do not change nutrition frequency at the same time. Metrics, reps tut, RPE and RHR. Evaluation, check for at the end. If not met, revert. For practical examples, real situations and recommended responses. Case 1. I don't see it in the mirror. Beginner. 6 weeks mental error. Short-term bias plus comparison. Recommended action. Apply 48-hour decision journal. Review logbook. +1 rep. If yes, gives continue and celebrate microgain. If not, review sleep calories. Do not change routine yet. Case 2. My friend trains 6 days and grows intermediate. Mental error. Comparison and action bias. Recommended action. Ask for context. Do they use PES? Diet, work, sleep. Maintain your plan. If you want to try something, do it as a controlled experiment. See above. Case 3. I feel like adding sets just in case. Advanced mental error. Volume illusion and ego. Recommended action. Use the before changing checklist. If the answer is no, use the 3-minute breathing technique and write down the impulse. If you still want to act, turn the action into a single experiment with metrics in a window. 5. How to turn patience into a competitive advantage. Long-term tactics. Accumulate self-credibility. Each complete block with correct recording increases your rational confidence and reduces impulses. Collect micro-victories. Keep a folder of minimal improvements, for example, +1 rep on press, and review every 3 months. You will see real accumulation. Design a public calendar. Mark 8 to 12 week blocks and deloads. Sharing it publicly forces you to respect it. Create a reward system. Small rewards for completing a block, not junk food. Book, clothes, massage, reinforces patient behavior. 6 brief exercises to train the mind. Daily practice, 2-minute journal, post-workout. Note 3, objective data points and 1 feeling. This trains the separation of sensation data. Urge surf breathing 3 to 5 minute. Every time you feel the impulse to change plans. Rational self-question 30s. Am I solving a real problem or fleeing uncertainty? If the latter, do not change. 7 closing phrases and mantras used in moments of weakness. Productive patience. I measure, I decide, I repeat. Micro progress today gives stable strength tomorrow. The notebook is my judge. The mirror, my late observer. Train with reason, not with pride. Inspired by Mentzer 8. Final printable checklist can be stuck in notebook before changing plans. Do I comply? Minimum window completed. 2/3 anchors with improvement. RHR, HRV and sleep okay. No relevant external stress. If all okay gives, allow 1 controlled change. If not gives, apply active rest or nutritional adjustment. 9. Closing applicable summary. Right now, the natural mind wants action and fast results. The heavy-duty method requires strategic patience. Install routines that transform impulses into processes. Check for 48 hours journal. Controlled experiments. Use your notebook as a weapon against impatience. If the data commands, not emotions. Practice self-control tactics, breathing, scripts, public commitment. Rational consistency is the most difficult and valuable competence. Section 8N equals 1 Practical cases, 3 detailed examples, checklists, and action plans. Extensive step-by-step design so anyone can apply it today. Each case includes diagnosis, immediate actions, 8-week plan, warning signs, and verification templates. Brief introduction. These 3N equals 1 cases cover real and frequent situations. The idea is to provide a clear protocol so the person can act without hesitation. What to measure, what to do first, how to reprogram, and when to escalate to medical tests. Always apply the if gives then rules section 4, and let the notebook be the authority. Case A. Beginner who feels no changes in 6 weeks. Typical context: training time 6 to 12 months. Program 1 effective set per exercise, 6 to 8 weeks completed. Complaint: I don't see it in the mirror, I don't feel changes after 6 weeks. Common data: strength may have increased but the person doesn't notice it visually. Sleep, nutrition, variable. Quick diagnosis 72H. Verify logbook. Was there objective improvement in reps or load in 4 to 6 weeks? Review technique: record 1 set and compare with previous sessions. Check recovery 7. Average morning RHR, average sleep, appetite, confirm adherence. Were sessions completed according to plan? Consistent calories, protein. Possible findings and their interpretation. A1. Reps or load have increased, gives neural progress exists. Appearance takes time. Action: maintain plan and keep measuring. A2. No improvement and RHRV. Bad or low sleep gives likely insufficient recovery. Action: prioritize rest and nutrition. A3. No improvement and poor technique gives correct technique before changing volume. Immediate actions 0 to 72H. If technique deficient gives video plus technique session, no sets to failure. If poor recovery, RHR plus 425 BPM or sleep less than 6H, gives active rest 48 to 72H. Prioritize sleep, plus 200 to 400 kilocalories per day if in deficit. If poor adherence, gives compliance plan, schedule sessions, set alarms, 8-week plan if the person wants to continue with basic heavy duty. Week 0 diagnosis and adjustment. Complete logbook review. Establish baseline last 2 to 3 sessions. Realistic goals. Start with process goals. For example, attend 100% of sessions. Sleep 7 plus H5 7 days. Weeks 1 to 4 stabilization phase. If technique was a problem, gives 2 weeks focused on technique with sets not to failure. Then return to 1 effective set. If nutrition was the problem, gives stabilized calories and protein. Minimum 1.2 to 1.6 grams per kilogram. Ideal 1.6 to 2.0 grams per kilogram if aiming to optimize record daily RHR and reps 2 to RPE in each session. Weeks 5 to 8 evaluation and micro-progression. Evaluate, plus 1 rep or plus 2.5% load in 2 anchors. If yes, apply micro load, for example, plus 2.5% and maintain cycle. If no, apply if then rule. If recovery okay, gives change 1 variable, for example cadence or exercise choice. If recovery poor, gives active rest 7 to 14 days. Practical checklist: printable window fulfilled, 6 weeks, 2 anchors with improvement, yes, no. 7D average RHR within plus or minus 2 BPM, yes, no. Sleep is greater than or equal to 7H most days, yes, no. Action gives maintain, adjust technique, increase KCOL, active rest. Signals to escalate to a doctor: persistent extreme fatigue after 10 to 14 days of active rest, recurrent infections, involuntary weight loss or marked loss of libido. Case B. Intermediate progressing 0.5 to 1% per month. How to capitalize on that? Typical context time 12 to 36 months. Realistic progress 0, 5 menos 1 load, month or plus 0.5 to 1% improvement in a metric per month. Goal: maximize those micro gains without breaking recovery. Principles to apply: accept micro gains as the norm. 0.5 to 1% per month is realistic and sustainable. Plan micro progressions and accumulate them. 1% month gives approximately 12% per year if maintained. Use progress levers: better nutrition, more sleep, prioritize anchors, optimized cadence. 2T initial diagnosis 72H, clear baseline load, reps 2T per anchor over the last 8 to 12 weeks. Recovery baseline, RHR, HRV, sleep, appetite. Identify priority anchors: 2 to 3 exercises that will transfer the most. Capitalization strategy: 12 weeks, 3 months. Phase 1. Optimize substrate: weeks 0 to 2. Nutrition: ensure plus 200 to 300 kilocalories if aiming to gain. Protein 1.6 to 2.0 grams per kilogram. Sleep: target 7 to 9H. Strategic supplement: creatine 3 to 5 grams per day if not already using. Review stress and reduce if possible. Phase 2. Controlled microprogression: block weeks 3 to 10. Maintain heavy duty. 1 effective set per anchor. Goal: per anchor, plus 0.5 to 1% load, or plus 1 rep every 4 to 6 weeks based on response. Practical strategy: If +1 rep in 2 sessions gives, then add +1 to 2.5% load. If no rep gives, maintain until 8 weeks before changing a variable. Incorporate intermediate goals, for example. In 8 weeks, increase press from 80 gives 82.5 kilograms. Phase 3. Consolidation and control weeks 11 to 12. Test on 3 anchors, review RHR/HRV, active deload in week 12 if the block was intense. Tactical tools, concrete examples, microload increments, use small weights 0.5 to 1 kilogram if available to avoid a sudden jump. Rep adjustments. If you can't add load, aim for +1 rep with the same load gives, then microload cadence TUT. Try moderately increasing TUT, for example, +5 to 10s. If you want a very stimulus without adding volume. Advanced techniques. Only if persistent stagnation in is greater than or equal to 2 anchors and recovery, okay. Use 1 technique per cycle. Section 6. Numerical example: person with 100 kilograms press, plus 0.5% month equals plus 0.5 kilograms gives practice. Increase 0.5 to 1 kilogram every 4 to 8 weeks based on rep availability. If they add +1 rep in 4 weeks with the same load, gives switch to +1 to 2.5% load. Checklist for capitalizing on microgains: baseline measured over 8 to 12 WKs, nutrition optimized plus 200 to 300 kcal if target is gain. Protein 1.6 to 2.0 grams per kilogram, RHR/HRV. Action: apply micro increase if 2 sessions with +1 rep. Warning signs are HR plus 425 BPM sustained, HRV minus 15% or greater, RPE rises to points without improvement, give step back, stop, and reevaluate. Case C, natural advanced, needing 4 to 10 days between sessions. Lower frequency or change exercises. Typical context time: 36 months. Natural program, classic heavy duty, 1 effective set, long, rests 4 to 10 days. Dilemma: reduce frequency even further or maintain frequency and change exercises to unlock progress. Initial diagnosis: 72H. Data collection from last 12 to 16 weeks. Reps load per anchor, RHR/HRV. Sleep infections, libido. Identify if the problem is general, all anchors stalled, or local 1 or 2 anchors decision. Lower frequency or change exercise. If systemic recovery is impaired, RHR plus 425 BPM, HRV drop 15%. Poor sleep, infections. Then lower frequency, add 2 to 4 more days between sessions and prioritize recovery. If recovery is okay but only 1 anchor stalls, then change that anchor to a mechanically more favorable variant. For example, free bar gives machine or change angle. Do not lower overall frequency if all anchors stall but recovery is okay. Consider a 7 to 14 day dayload and then return with micro variation of exercise. Improve technique or choose variants. Detailed protocol according to scenarios. Scenario C1. General stagnation plus poor recovery, immediate actions. Active rest 7 to 14 days. Nutrition plus 200 to 400 kcal. If in deficit, prioritize sleep. Evaluate external life. Reintroduction. Sessions every 9 to 14 days for the first 4 to 6 week block. Monitor RHR 8-week goal. Return to baseline reps in at least 2 anchors, if not gives medical tests. Scenario C2. Localized stagnation 1. Anchor plus recovery, okay. Immediate actions. Substitute anchor with variant-free press gives machine press. Deadlift gives rack pull or hyperextension plus weight. Maintain frequency. 8-week plan. 2 to 3 sessions for that anchor according to frequency. Measure reps TUT. If it improves, gives maintain. If not, gives try another variant or specific technique, only 1, and monitor. Scenario C3. Recovery okay plus mild general stagnation actions. Implement 1-week deload, then reintroduction with 1 to 2 more days between sessions. For example, if you did 7 days, gives move to 9 to 10 days. Evaluate 2 cycles. If it improves, maintain new frequency. 8-week plan, example for advanced, needing to decide. Week 0, complete diagnosis and baseline. Weeks 1 to 2, intervention according to scenario, active rest or anchor substitution. Weeks 3 to 6, reintroduction with new frequency exercise. Record daily RHR and reps. Weeks 7 to 8, test on 3 anchors. If 2/3 improve, gives continue. If not, gives extend recovery and consider medical tests. Micro-progression rules for advanced: extremely small increases, plus 0.5 to 1% per month, or plus 0.5 to 1 kilogram when possible. Do not increase frequency if you feel the need to train more. Prefer adding mobility, rehab, and not sets to failure. Decision checklist: printable, RHR plus or minus 2 BPM, HRV stable, general or localized stagnation. If general plus high RHR, gives lower frequency and rest 7 to 14 days. If localized plus RHR okay, gives change exercise to a more favorable variant. Signals to see a doctor: sustained loss of strength and libido, extreme fatigue, recurrent infections, gives tests. Blood count, ferritin, thyroid panel, testosterone as indicated. Recording templates, example entries useful for all 3 cases. Minimum format per session per day. Date, exercise, anchor, load, reps, cadence, TUD, RPE. Morning RHR, sleep age, 10 notes, appetite, libido, DOMS, example, beginner, the 1st of September 2025, machine press, 80 kilograms, 8 and 3/1, 140 S10, RHR 59, sleep, 7.5, 10 notes, high energy, example. Intermediate, the 15th of September 2025, leg press, 180 kilograms, 10 and 3/1, 150 S10, RHR 56, sleep, 8 tense notes plus 1 rep versus the 15th of August 2025 gives plan microload plus 2025, advanced the 22nd of September 2025, bench press machine 100, 20 120 25 Clifson, 2025 and 20 the 21 1 to a second 20, with 102 cent 1 to 1 1 100 fem to 1 point in 1 to the 1 and in 1 star to 1 so or 2 7 and 3/1 142 S10 RHR 61 plus 4 versus baseline 57. Sleep 6 tense notes. High RHR gives. Postpone intense session, common success signals after intervention, what to expect and when. 72 to 96H subjective sleep and energy improve after active rest. 7 to 14 days, RHR drops towards baseline, DOMS normalizes 4 to 8 weeks. Increase in reps or small microload and 1 to 2 anchors if the intervention was correct. Greater than 8 weeks. Consolidation and return to usual programming or controlled advance. Conclusion of the 3 cases: beginner, patience and focus on technique plus substrate, eat and sleep. Do not change before 4 to 6 weeks. Intermediate, capitalize on micro gains with nutrition, sleep, and micro progressions. Plan 8 to 12 week blocks. Advanced, decide between lowering frequency or changing exercise based on whether the problem is systemic or localized. Use deloads and microvariations. Section 9, final checklist and 8-week plan step roadmap, what to measure, what to change, and when. Ready to paste into your notebook. This section is practical. You have clear rules, numerical thresholds, examples, and an 8-week schedule to validate if your slow progress is real or if you need to reprogram. It's designed for gyms and home bands, dumbbells, body weight. If any term is unfamiliar, I explain it below. Quick summary, what you will do. Record a few metrics daily, do measured workouts. Effective set equals 1, set 2 technical failure. Review weekly and make decisions based on if gives then rules. Execute the 8-week plan. Stabilize gives optimize gives evaluate gives decide. Quick definitions so there is no doubt. Effective set, the only set you count as real training. Taken to technical failure or RPE 10 according to your plan. TUT, time under tension. Seconds, the muscle is under load in the effective set. RPA 1 to 10 scale of perceived exertion, 10 equals failure. RHR, morning resting pulse. Best taken with watch monitor for 60 S upon waking. HRV, heart rate variability if used. Compare percent versus baseline. Window, minimum period for evaluation. Beginner for WKS, intermediate 6 to 8 WKS, advanced 8 to 12 WKS. Deload, active rest phase of reduced intensity. Volume to recover. What to measure daily per session, weekly. The essential minimum list: daily morning RHR morning pulse. 1 reading of 60 S sleep hours plus quality 1 to 10. Energy reserve 1 to 10. Energy reserve 1 to 10, how you feel about training. Appetite 1 to 10. And note, deficit maintenance. Surplus per session, immediate recording. Exercise, anchor, load, kilogram or relative weight. REPS, effective repetitions. TUTS, approximate RPE at the end of the effective set. Observations, technique, DOMS, discomfort. Weekly summary, 7-day average RHR, HRV trend if used, percent change versus baseline, progress, +1 rep or +1.5 to 2.5% load in anchors. Yes, no number of days with sleep. 6H, incidents, colds, travel, extra stress, numerical thresholds for decisions. Use these if gives then rules. RHR OK, ±2 BPM from baseline. Caution, +3 to 4 BPM sustained. For 3 to 5 days gives consider recovering. Alarm, +5 BPM sustained. 4 is greater than or equal to 4 to 7 days gives stop, intensify recovery. HRV, drop 15% sustained, gives caution. RPE increase is greater than or equal to 2 points without improvement in reps gives reduce intensity. Reps, absence of +1 rep in the minimum window according to level in is greater than or equal to 2 anchors gives diagnosis. DOMS limits technique greater than 72H gives extend recovery. Sleep, average less than 6H for 3+ days gives break. Appetite, libido, drop of 2 points sustained, gives investigate nutrition, health, quick decision rules. Printable. If no improvement in is greater than or equal to 2 anchors in the minimum window, then do not add volume. Apply diagnostic checklist. If RHR plus 5 BPM sustained, then active rest 7 to 14 days. IFRPE plus 2 and reps, same. Worse, then suspend sets to failure in the next session and add 48 to 72 H before attempting. IF only 1 anchor fails and the rest progress with RHR okay. Then change variant exercise for that anchor. Do not change everything. IFU. Introduce an advanced technique, then record DOM's RHR and add plus 3 to 7 days of recovery for that area. Use 1 technique per cycle. Printable daily checklist list pasted in your notebook. Morning RHR BPM. Sleep HRS quality 110. Energy 1 to 10. Readiness for session. Yes, no training. Exercise load reps. TUT RPE DOMs. 0102448. H later notes. Travel. Stress. Illness 8-week plan. Detailed roadmap plan. Objective validate if slow progress is real. Reproducible microgains or false stagnation due to recovery nutrition programming. At the end of 8 weeks you will make a decision. Continue, adjust 1 variable, or stop for recovery. Week 0. Preparation, initial diagnosis. Actions, establish baseline. Record 2 to 3 previous sessions weight, reps, TUT, RPE. Calculate RHR, HRV and sleep averages from the last 2 weeks. Decide your window according to level beginner, intermediate, advanced. Print and paste the daily checklist in your notebook. Goal: have clean data for comparison. Week 1. Stabilization training, 1 effective session per group according to your template. See Section 5. Use constant cadence. Nutrition. Ensure kcal if aiming for gain plus 200 to 400 kilocalories per day. Maintenance if you don't want to gain protein 1.6 grams per kilogram minimum if entering a progression phase. Recording daily RHR note session. Action: if RHR plus 5 or sleep less than 6H, postpone sets to failure until stabilized. Week 2. Optimize recovery and technique training. Repeat measured session. If technique is doubtful, do a set not to failure to correct it. Recovery. Strict sleep hygiene. Prioritize 7 to 9H. Check compared data with baseline. Note any increase in RPE without improvement. Quick decision. If RHR plus 3 to 4 and rep same gives AD 48 to 72H and re-evaluate. Week 3. First attempt at microprogression only if readiness okay. Training. Effective set as always. If in week 1 to 2 there was plus 1 rep on anchor X gives trial light microload plus 2.5%. On that anchor this week, record DOM's reaction, RHR 3 to 7 days afterwards. If RHR DOMs spike without improvement in 7 days gives revert load and extend recovery. Week 4. Midterm evaluation checkpoint evaluate. Is there plus 1 rep or plus 1.5 to 2.5 to 2.5% load and is greater than or equal to 2 anchors since baseline? Yes, no. Is RHR stable plus or minus 2 BPM? Is sleep is greater than or equal to 7H most days? IF the answer is yes. Gives continue plan and schedule additional microprogression controlled. IF the answer is no. Gives apply diagnosis. Review technique, sleep, calories, and stress. Do not add volume. If recovery poor gives active rest 7 to 14 days. Week 5. Adjustment based on evaluation if you progressed. Consolidate the microload, maintain same frequency if you did not progress in recovery okay. Change 1 variable, for example cadence, anchor, exercise, peri-workout carb timing. Make this change only 1 in record if you did not progress in recovery poor. Active rest 7 to 14 days. Prioritize sleep, calories. If it doesn't improve gives medical tests. Week 6 reintroduction or consolidation training. If there was active rest in week 5, start with 1 set not to failure per anchor and progress if data okay. Record RHR reading and quick test on 1 anchor. Same load tempo as baseline. Decision. If test shows recovery gives return to effective set the following week. If not gives extend recovery. Week 7 second evaluation evaluate. Repeat the week for checkpoint. IF progress is seen to thirds indicators. Plan to maintain and schedule deload for week 8. If no progress is seen and you tried 1 adjustment without success, consider active rest 7 to 21 days, and if it persists medical evaluation. Week 8 consolidation and final decision active deload. Reduce volume 50 to 70%. No sets to failure. Final decision based on data. Continue with the same plan for another block. If at least 2 out of 3 indicators improved and recovery is green. Adjust 1 variable if 0 to 1 indicators improved but recovery is okay. Try plus kcal. Change anchor, adjust cadence, reprogram. Stop if 0 indicators in recovery poor give stop for 2 to 4 weeks and reevaluate with medical tests if necessary. Concrete examples how to do it in the gym and at home. Example GYM beginner 70 kilograms, week 1 session. Machine press 80 kilograms times 8 reps, TUT approximately 40 SRP, 10, RHR 60, sleep 7, week 3. Records: 80 kilograms times 9 reps gives micro progression. Week 4, try 82.5 kilograms times 8. If RHR rises to 65 in week 4 after microload, gives step back deload. Evaluate sleep. Example: home with bands, dumbbells, anchor. Press with bands plus dumbbells. 3 warm-up sets. 1 effective set with 20 to 30 s tut times 8 to 12 reps to failure. RPE 9 minutes ds. Comparative tut. Use tempo 3s eccentric 1s concentric gives 4s rep. If you do 10 reps gives tut 40s. Keep tempo always the same to compare. Micro progression. Increase band tension or add 1 to 2 kilograms to dumbbells when you achieve +1 rep with the same tension. What to change and when. List of practical interventions. If lack of progress plus poor recovery gives increased sleep. Increase KCO plus 200 to 400 active rest. If lack of progress plus recovery, OK gives change one variable. Move to a better mechanical variant machine/different grip, or adjust cadence. Increase tut plus 5 to 10s, or correct technique with video, or improve peri-workout carbohydrate timing. If progress but stagnation, again gives small microload plus 0.5 to 2.5%. According to level. If severe fatigue or systemic symptoms, give stop and see a doctor. Printable 8-week plan checklist. Printable week 70 average RHR BPM baseline gives OK. Caution: alarm average sleep. H gives OK. Potion alarm average. Hote alarm anchor 1. Load reps tut RPE. Anchor 2. Load reps tut RPE plus 1 rep or micro load in is greater than or equal to 2 anchors since baseline. Yes, no. Recommended action. Continue. Adjust one variable. Active rest. Medical consultation notes _ practical tips and reminders to do it. White: always record immediately after finishing the set. Don't trust your memory. Keep cadence constant while measuring progress. Changing tempo changes tut. Don't change more than 1 variable at a time. If you change 2, you won't know what worked. When using advanced techniques, add extra recovery days and use them rarely. When in doubt, prioritize sleep and food. They are the most powerful levers. The mirror is late. Give your strength time to accumulate mass. Closing phrase to paste in your notebook. Measure gives decide, gives execute, gives verify. Patience with criteria. Slow, measurable progress beats the noise. Section 10. Philosophical closing and call to action. We have reached the end. All this boils down to a simple, powerful idea worth repeating until it becomes a habit. Measured patience beats the noise. This means less impulsive reaction and more data-driven decisions. Less doing for doing's sake, and more doing what generates adaptation. Less volume by fashion and more intensity applied with criteria. Now comes the practical summary, how to apply it day to day, and the final invitation. Quick recap: the essentials you must take away. The correct stimulus equals intensity taken to technical failure when appropriate. Recovery is the real work. If you don't rest or eat enough, failure is just damage. Always measure the notebook. Reps 2 TR, APER, HR, sleep, appetite. Libido is the authority, not the feeling. Temporal windows: respect the window according to your level before changing. Beginner for WKS, intermediate 6 to 8, advanced 8 to 12, 1 variable at a time. If you change load, don't change tempo, exercise volume at the same time. Advanced techniques, use them rarely in 1 exercise per cycle, and only if recovery is okay. If data and recovery fail, give stop and recover. Active rest 7 to 14 days or more, depending on severity. How to apply it: day-to-day practical roadmap. What you do tomorrow. Daily routine minimums. Upon waking, measure RHR 60s, and note hours plus sleep quality. Before training, quick readiness check. RHR plus or minus 2 BPM. Energy is greater than or equal to 6/10. Acceptable sleep gives. If not, postpone intense session. During the session, 2 to 3 non-fatiguing warm-ups. 1 effective set per anchor with consistent cadence. Note load, reps/tut RPE immediately. After note DOMS and any discomfort. Review if anything appeared: travel, stress, insufficient food. Simple decision rules always visible in your notebook. If 2 anchors do not improve in the minimum window, gives then diagnose technique, recovery/nutrition, and do not increase volume. If RHR plus 5 BPM sustained, gives then active rest 7 to 14 days. IFRPE plus 2 without improvement, gives then reduce intensity and add rest. If you decide to try something new, gives then do it as a controlled experiment. 1 variable, define duration, clear metrics, what to change first if needed. Sleep 7 to 9h, fix it before increasing sets. Calories, if you are in a deficit and want to gain, add plus 200 to 400 kilocalories per day. Technique: exercise selection, substitute 1 anchor for a safer variant or machine if technique fails. Frequency, if the body asks for more rest, reduce frequency before increasing volume. Behavior plan for 8 weeks, ultra practical summary. Week 0 baseline, record 2 to 3 sessions and RHR sleep averages. Weeks 1 to 3, stabilize sleep. KCO, technique, follow your template, 1 effective set per anchor. Week 4, midterm check, plus 1 rep or micro load in is greater than or equal to 2 anchors. If yes, gives micro progression. If no, gives apply diagnosis. Weeks 5 to 6. Adjust according to diagnosis, only one variable. Week 7. Second check. Week 8. Active, deload and decision. Continue, adjust, stop and recover. Use the checklist from section 9 each week. How to do it at home or in the gym. Short example. Gym. Use machines for sets to failure. Safer. Anchor equals machine press, rows, leg press, warm up to approximations, 1 effective set. Record. Home. Use consistent tempo and tut with bands, dumbbells. Keep the same cadence session to compare. Micro progressions with more tension or weight. Message to remember, practical and repeatable. Always measure. Change only one variable per cycle. If data and recovery are good, gives persist. If data or recovery are bad, gives break and replenish. Call to action. Share this. If this chapter helped you clarify things, share the video. Every person who stops punishing their body for seeking quick results gains weeks or months of health and real progress. Share it with someone who trains a lot and doesn't progress. You could save them from an injury, frustration, or years of setback. Mike Mentzer's final phrase to close. For exercise and bodybuilding to be productive, it must be intense, brief, and infrequent. Mike Mentzer, and another that sums it all up. If you don't rest enough, you don't grow enough. Mike Mentzer used them as a motto. Intensity plus rest equals real progress.